Welcome to A Parent's Guide to Child Development. I'm your host, Annamarie von Firley from Fledgling's Flight. Each podcast, we strive to give parents the tools they need to help their child thrive through conversations with experts in child development and psychology, where you can learn about the most important information that you didn't know existed. In our first two conversations with Emily Roper, we covered what primitive reflexes are and took a deep dive into the fear paralysis and moral reflexes, the two that wire your child's sense of safety. Today, we're tackling the question that comes up over and over again in the comments. How does this happen? Why do some kids glide through reflex integration on schedule while others get stuck? What can go wrong during pregnancy, birth, and that first year that derails the process? And maybe the most important question, how much of this is in our control? In this episode is the one I've been most excited to record because Emily lives in the rare intersection of birth work and neurodevelopment. She's a Neuro-Developmental Delay Therapist, a certified midwife's assistant, founder of Early Roots, and host of the Early Roots podcast. She's attended over 600 births and walked hundreds of families through pregnancy, birth, and postpartum, which means she has seen firsthand how the choices, the circumstances, and sometimes the chaos of those early months show up years later in a child nervous system. Emily, welcome back.
Thank you for having me again.
Yay! Oh, I'm so excited about this. I just noticed the pink tree behind you. What's going
I
on there?
do. I have a pink Christmas tree that stays up year round.
Oh, I love that. I feel like the last recording, if it was there, I didn't notice.
I might have been blocking it.
It's adorable. All
Thanks.
right, so Christmas in July.
Exactly.
We've talked about what primitive reflexes are and what happens when they don't integrate. Today, we're getting into the why they don't integrate. From your vantage point as both a birth worker and a developmental therapist, what is the big picture parents need to understand?
Sure. So when we look at complications and risk factors, we first have to kind of back up and understand how the brain and body develop so that it's a lot easier to understand why things can go wrong. It's just like it's just like midwifery. You want to know normal first before you get into complications. So but basically, the brain develops. There's two major concepts about brain development that are important. The first is that it develops in a very orderly way, with the earlier parts of the brain and the physically lower parts of the brain developing first, and then higher parts of our brain develop next. And these parts of the brain are also responsible for more and more complex things. So we develop from simple to complex. We develop from the bottom to the top. And this whole process happens in a very orderly way. So each stage kind of leads into the next, and each one is built on the things that happen before it. So these early pieces, like reflexes that I'm looking at, these are pieces that are regulated by the brain stem, which is the lowest part of the brain, which means that these are very simple, and I mean simple developmentally, like these are very simple processes and movements. And these parts of the brain are all the like automatic kind of lizard survival type parts of our brain. And these things happen first. They're developing prenatally. And then as babies get bigger and bigger and their brains develop more, other parts of our brain should take over and we should have much more complex processes that are in charge. And this whole process of development happens through movement, use, and interaction with the environment. So, how we move our bodies, the types of things that we experience, and the environment that we are in directly impact how our brain develops and functions. It's all based on use. And so, given those things in mind, it can be a little easier, I think, to understand that when we have problems and complications that happen early, like prenatally or in early infancy, when these low parts of the brain are being active, that those are the parts of the brain that are going to be affected. And if we have problems with those early foundational pieces, then we're going to have holes and gaps and problems with the way the rest of the brain develops. And depending on the way we move, depending on the types of things we experience, those also shape how the brain develops and functions. So, When we're looking at older kids that are struggling with something like emotion regulation or attention or reading and writing, these are all really advanced brain skills. And so you want to back up first and look at these early development pieces and see, do kids actually have the tools and skills that they need to read and write and regulate and all of these other things? And oftentimes they don't. And what we're seeing is problems that started really early that have cascaded into problems later on. So my goal is always to back up and look at these early pieces. And so when we're looking at things like complications and risk factors, we're looking at that early development time piece because that's when most of these foundational pieces are being built, is basically before the first year. Obviously, there's lots and lots of things that are being built in throughout early childhood, but specifically the things that I'm looking at and most concerned about happen from conception through the first year.
Is reflex retention something parents cause, or are they things that are truly outside of our control? How do you talk to families who are already worried that they've already messed up?
Well, first of all, I would say that the brain and body are very resilient. Our nervous systems are designed to react and respond to our environment and to constantly be developing and adapting. So, just like we know that like negative experiences and trauma can have like a negative impact, positive experiences, the right therapeutic approach, all like the right environment can have the exact same effect in a positive way. So we're never stuck. It's never too late. We're all pretty adaptive and resilient for the most part. And I never, when it comes to parents that are like worried about whether or not they caused it, I just say there is no room for mom guilt in this world. We already have too much shame and mom guilt and parent guilt in general. So let's just drop all that at the door and figure out what we can do next to support kids because a lot of this isn't in our control. Some is and some is not. But when you look at something like risk factors, it's rarely do I ever see that it's one single thing. Usually it's a combination of a lot of things. And eventually, with kind of enough hits, the nervous system can't adapt right. And you see these kind of long-term consequences. So that's not always true. There can be like single really significant traumatic things that cause, long-term stuff. It could be something as like a single seizure that's really significant or a single extended period of oxygen deprivation. Those are pretty traumatic. That's something that can have longer consequences, but usually it's a combination of a lot of different things. Usually, it's also things like our genetics make us more or less susceptible to these types of things. So sometimes we just have genes that make us more sensitive and more easily like reactive to the types of risk factors that babies may experience. We live in a pretty toxic environment. In the US, especially, we are exposed to lots and lots of different environmental toxins. We know that babies, there's a study I saw recently that looked at like umbilical cord blood and found over 200 known toxins in
What?
most umbilical cord blood. So these babies are swimming in it, man. They're really exposed to a lot. And if you have a body that is exposed to that many environmental toxins, it's no wonder that they can't cope with things like a bad birth or, moms with chronic stress or some sort of illness or something. Like they're already at max reserve and they just don't have anything left in the tank to adapt. It really kind of tanks our resiliency. And that's something that you have some control over, but in, a very real sense, there's a lot that is outside of our control when it comes to things like that.
Man. Most parents have never heard a single word about reflex integration from their OB, pediatrician, or hospital. Why isn't this a routine part of prenatal and pediatric care?
Yeah, this is something that really frustrates me about our kind of whole medical system. One of many things, probably. Um, but we're so specialized and like in our own world and compartment that most people who are working with babies are not the same people that are working with older kids and adults. That's not true. You can have like your pediatrician and stuff that does that, but the OBs, the people, for example, who are delivering babies, are not the same people that are taking care of kids with ADHD when they're older. There's a pretty big disconnect, and we tend to be so specialized and hyper focused on our like one specialty that we miss a lot of the broader picture. And it's true that like OBs, well, not necessarily OBs, but pediatricians that are working with newborns, they're testing for these reflexes. Midwives, it's one of the big parts of the newborn exam that we do after babies are born. We're looking for all of these reflexes because we know that if a newborn baby does not have these reflexes, that's a big major red flag that neurologically there's something going on, neurologically or genetically, that there's a problem and we need to do a lot more screening and testing. But then we just assume, like, okay, then they're going to disappear properly, and we don't test for them later on. We don't look for that. That's just not a part of our screening. And I think that's just kind of the way that this system has evolved to work. We look at things like mental health through a very specific, like mental disorder lens. We don't look at it holistically through a brain and body lens. We don't look at it through like a social emotional lens or through an environmental lens. That's just kind of the box that we look at, and it's just missed. There's just gaps. Although that is something that I think is changing. I think people are becoming more and more aware of how all of these pieces are connected and that we are, our brains and bodies, and we're one whole unit and one whole person, and all of these things affect us in ways that are very closely connected.
Well, we're doing our part.
I'm trying, man.
Maternal stress is one of the biggest factors that can interfere with reflex development in utero. What does chronic stress do to a developing baby's nervous system? And what level of stress are we talking about? Everyday work stress, or is there something more extreme?
I mean, it can be. Yes, no, it's really stress is one of those things that's really hard to quantify because we talk about that a lot, but it can look very different from person to person. And ideally, what you want when you talk about managing stress and what is healthy stress is you want people that experience spikes of stress and then good recovery. And that's normal. That's the way that we interact with the world is stressful things happen and then we recover. And that is a healthy, normal, resilient body is we can experience stress and we can recover. What is not healthy and normal is this kind of elevated, chronic, low to medium to high levels of stress constantly. Our bodies aren't really, we haven't evolved and adapted to live in that type of environment. And unfortunately, a lot of our current world fosters and like facilitates that type of mode. And the same thing is true for moms as it is for babies. We look at umbilical cord blood and we think, oh, those babies have been exposed to those toxins, but mom is too. We
Mhm.
have like a lot of things that cause a lot of stress on our body that may not even be emotional, but it really kind of tanks our ability to be resilient. It's just like a lot of different hits. So it can be things like, just chronic work stress, or we're moving, or we're getting married, or whatever it is that are just like normal life events that are stressful, that can affect things. And then certainly there are situations that are like genuinely and deeply more traumatic and stressful. So I've worked with a lot of kids where mom was in domestic violence situations when she was pregnant. That's going to have a huge impact on babies. Their little nervous systems know that they're not in a safe environment and they're coming into a world that is not safe and stable. And they're going to respond and adapt to that. And that's healthy. Like, I don't want to demonize this at all. I want people to understand that if you're not safe, you're like while you're pregnant, then your baby's adaptation to be more sensitive and to kind of be in that survival mode is healthy. That's a normal, healthy reaction. The problem is that's not always adaptive after, and that doesn't automatically switch over if all of a sudden now we're in a safe space. Like these things don't just kind of flip afterwards. So there can be a lot of things that happen stress-wise prenatally that are risk factors
Hmm.
for these babies.
What are other in utero factors that can disrupt reflex development, such as substances, smoking, certain medications, environmental toxins, nutritional deficiencies, illnesses during pregnancy?
Yeah, all of these things are risk factors. So anything that mom is experiencing, baby is going to experience to some extent too. So certainly moms that experience a lot of illness, and I don't just mean like you got food poisoning once, but it was kind of mild, or you got a cold. Like we're pretty resilient, and our bodies can handle small things. But moms that have something like cancer or like a really significant illness that have like gestational diabetes that's out of control or that develop really significant preeclampsia or where their body is inflamed and stressed and not safe, babies don't know that they're separate from that. And in reality, when we're pregnant, they're not. They are living in that environment too. And so those are certainly risk factors. Any sort of drug exposure like that, and that can be, like prescription drugs, that can be illicit drugs. It doesn't have to just be things like heroin exposure. It can be medications that we take. And that's not to say I want to be really clear that I'm not saying that if you are on something, if you're on like a psychotropic medication before you get pregnant and you get pregnant, that doesn't mean you need to get off of it necessarily. There's a lot of nuance to whether or not it's riskier to stay on your meds or to go off of it and have like uncontrolled mental health stuff going on. That's like a very nuanced conversation to have with your doctor. But those things are all factors that play a part in how that baby's brain is learning to function. And all of those things affect the nervous system, affect their stress response, affect the way that they function after birth.
How does the position of the baby in the womb, restricted movement, or low amniotic fluid affect the reflexes that are supposed to develop before birth?
Yeah, so this gets back to, the idea that the brain develops through movement. And when I say that, I literally mean how we move our bodies. We like to think of our brains as being these very separate things from our body, but our brains are just a part of our body. And the way we move our body, the way we interact with the environment directly affects the way that our brains work. So when we have moms that are put on like extended bed rest for a long period of time, which is not common anymore, that's a pretty rare thing that we see now. It used to be that like anytime mom was sick with anything, we put her in bed and don't let her move when she's pregnant. And there was like I think that was just a lot of fear around like trying to keep moms and babies safe. Probably came from a good place, but we don't see a lot of like really extended bed rest. But for some moms, that was a thing. And if they're not moving, then baby's not moving in the same way. They're not getting the same input. Like you said, if they have a lot of like really low amniotic fluid where they can't move quite the same, that's going to affect the way those reflexes develop. That's going to affect the positions they can get into for birth. That's going to affect the way their birth goes, all of the above. Um, and sometimes that's not a big deal and babies recover and they're fine. And other times it's like one additional thing that we're adding to the kind of checklist of things that are contributing to poor development for this kiddo.
Mm. Multiples, twins, triplets, and IVF pregnancies tend to come with their own set of risk factors. What should parents of multiples or IVF babies specifically be aware of?
So there's a couple of things to think about when you're talking about something like IVF. And the big question, like the big concern is why fertility was a problem in the first place, or maybe it wasn't a problem and you're just going that route because you're in like a lesbian couple and you can't conceive. That might be very different if you have like there's no fertility issues whatsoever versus there's some underlying fertility issues. And that goes back to the environment in which babies are developing in. And one of the things that we consistently see is when there's a variety of different problems, one of the first things that seems to happen is fertility decreases, which makes sense evolutionarily. If there's a problem, then we're going to see fertility decrease. It's one of the most sensitive things to all sorts of different problems. So if we're having underlying fertility issues and we don't address those first, then that could be affecting baby. And then the type of conception and things that happen. The process of natural conception really goes a long way in weeding out a lot of like sperm and eggs that might be healthy, but they might just not be genetically compatible. So we know that actually like we used to think that whatever sperm reached the egg first, that was it. They got, they fertilized the egg. But we now know that like eggs have a very complex process of either attracting or repelling sperm that is not compatible with them. So there's a lot of like nuanced genetic things that are going on that might be might be helping to weed out things that would make us more susceptible to problems later on. When you do something like IVF, you're bypassing some of those things. And so there's just a slightly greater chance that there might be some incompatibility or some problems there. And again, these are just like, it's not like this is the end all be all, or you can't have a healthy pregnancy with IVF, or, it's just one factor. And they can add up over time, or it could be nothing, and your kid could be just fine.
I never even knew that
Hmm.
about the egg being able to attract or
Hmm.
repel sperm. Huh.
Oh, and then I didn't answer about the multiples. So the thing
Yeah.
with multiples is mostly the concern with multiples is just that they're at a higher risk of other complications. It's not actually necessarily that being a twin is problematic by itself. It's that they're more likely to be born early. They're more likely to have other complications. They're more likely to have interventions at birth. OB, like a lot of OBs tend to have very strict guidelines about how you can birth when there's multiples and all of these other things that are going on, that change the birth experience and may increase their risk factor of something like a cesarean or forceps or vacuum delivery or a mom that is like heavily medicated during her labor or other compounding factors too.
Mhm. You've attended over 600 births. What are the most common birth scenarios you see that later show up as retained reflexes, and which ones surprise parents the most?
So Um, when the INPB, the school that I was going to, they were developing a screening questionnaire to see if they could find a way to basically screen for kids and see, can we look at risk factors and figure out what kids are at risk and what types of things contribute. I think everybody expected like it's going to be a lot of pregnancy stuff, it's going to be a lot of infancy stuff, and they were surprised that they found that the biggest risk factors were related to birth complications,
Mm.
that had the biggest impact on whether or not kids would have retained reflexes later on, which I think surprised everyone. It makes a lot of sense once you like pause and step back and think about it and understand that when babies are being born, that they are actively participating in their birth. They use a lot of these reflexes to get in position and to assist with that process. And the process of a normal labor, birth, and early postpartum help to really like solidify and get all of those things to be working properly. So it's really like setting kids up for a lot of positive things too. So the biggest complications that we look for when it comes to birth-related things would be a cesarean delivery, a forceps or vacuum delivery, something like sustained trauma of any kind during birth, whether that's a head injury from the birth, a shoulder injury, whether that's something like a significant shoulder dystocia where they're deprived of oxygen for a long time, whether that's like they had sustained low heart tones and they're struggling. They're born and they need a lot of interventions after to start breathing, or they have to go to the NICU and they're separated from mom, or they need a lot of like other things to get them breathing on their own. So like they have a lot of the deep suctioning or things that affect, like when you're suctioning a baby after birth, if they're not expelling that fluid properly, you have to be really gentle. You can really like do a lot of harm and damage to their mouth and their throat and affect the way that they nurse afterwards and the way that they use their mouth after birth. There's just kind of like a lot of compounding things that can happen during the birth process that really disrupt this early development piece.
Mm.
Um, and I'm happy to kind of get into those more nuanced if you want, or we can jump to something else too.
Oh no, yeah, dig in.
So if you look at things like, because people ask me a lot about cesareans and kind of why that is a risk factor. And I think it's important to look at kind of the broader picture of cesareans. So one of the things that's really important for nervous system development and reflex development is labor. So as moms are going through labor and they're experiencing a lot of contractions, that's stimulating baby's nervous system. It's actually raising their cortisol levels pretty significantly. Babies have really low cortisol levels in the womb, and then you want them to have much higher cortisol levels after birth so that they'll start breathing on their own and they'll do all those those transitions that they need to make. I think people hear cortisol and think, that's bad, but cortisol is really good, actually, in the right context. We need it. So these babies, labor is helping to raise those cortisol levels. It's helping to stimulate and prime all those reflexes. So going through labor is beneficial for babies. It's very helpful for them. So if you're doing something like a cesarean, you have to wonder, is this a scheduled C-section? Has she just had C-sections in the past, so she scheduled it, and maybe that baby is not actually ready to come out, and they don't experience all the benefits of labor. They just go from they're in the womb to boom, they're out, and now they have to do all these things on their own, and they had none of the prep that makes that more helpful. When you're born by cesarean, you don't get the same squeeze that you get when you're born vaginally. And that squeeze of actually going through the birth canal helps to push fluid out of the lungs. So when babies are in the womb, their lungs are really compressed and they're full of fluid. And so all that fluid gets pushed out, and then they take a breath and it fills with air and it helps to push out the rest of the fluid that's in there. So going through the birth canal helps with that process. We miss that when we're born by C-section. And we know that there is a correlation between babies that are born by C-section and other like lung related issues like asthma later on, which asthma is both a lung and kind of an immune issue too. And the other thing that's happening is when you're born vaginally, you're exposed to a lot of good bacteria that help to seed your gut, and it really provides the foundation for our early microbiome. It's not the only thing. There's a lot of, we have several different kind of layers of bacteria that help to seed that gut. But a vaginal birth plays a big role in that. And we know that our gut microbiome shapes both mental health and physical health in huge ways. And so that can set babies up to have, more immune and mental health issues and struggles later on too. And then babies that are born by C-section are more likely to need interventions. I said, like the suctioning, they're more likely to be separated from mom. They're more likely to have other compounding things that happen. And then you have to wonder, are they doing a C-section because that baby's not okay? And it's an actual emergency C-section. Is mom like put under general anesthesia, which is going to affect babies in some way? There's kind of a lot of different things that go along with C-sections. And then with things like forceps and vacuum delivery, that's when you use either a vacuum is this little thing that you suck onto baby's head that they actually pull to help when moms are pushing. Forceps are like these little clamps that go over and they're used to both rotate baby's head to get them into a better position and used to pull. They're intense. They're helpful when you need them in the right situation, but it's a lot of force and a lot of pressure on the head and neck. And they typically come out with a lot of bruising, a lot of swelling. They're more likely to have injuries with their neck. And even if they're a mild injury where it's not like full torticollis, but they're like injured or more sensitive, it's going to affect the way they move after birth. And it's going to affect the way they use their head. It's going to affect the way they breastfeed. It's going to affect the way all of those reflexes function after birth. And babies really rely on these early reflexes to help them develop all sorts of things because they don't have control over their movements. These little babies don't choose what they're doing. It's all pretty much reflexive. It's all these like early ingrained motor patterns. They're not choosing what they're doing. And so when they have a neck injury, that dramatically affects the way that they move their head and the way these reflexes are expressed. And so a lot of times too, parents don't realize that a baby that's having trouble nursing or having trouble latching or seems uncomfortable or only prefers one side, that there might actually be some pain or discomfort or problems with the way that their neck is functioning, especially if there was some birth trauma. But even if you have a pretty natural birth, it's still a lot. Some babies just get a little sore or they experience some injuries. If you have something like a significant shoulder dystocia where you really have to get in there and move to get baby out, they're more likely to have pain and discomfort, and it's going to affect the way they move. And then you see this long kind of cascade down the road. So again, we look at birth complications, but it's never one thing in isolation. It's always this that leads to this, that leads to this, and then they wind up in my office when they're 7.
Oh my gosh. So you talked about some birth interventions like vacuum extraction and forceps, but what about more what's the word I'm looking for? Like medicinal interventions like induction, epidurals, pitocin. Like how do these affect the nervous system and reflex development in babies?
Yeah, so this is a little tricky because people ask me that all the time, like, is there a connection between epidurals and primitive reflexes? And we don't have good definitive studies that say yes, epidurals do this. So what we know is inductions are a risk factor for a couple of things. One, because it disrupts a lot of the physiological communication between mom and baby. Also, you have to wonder why they're being induced. So oftentimes an induction is a risk factor because they're not ready to come out. So they might not be premature from like a clinical standpoint, but it could be that they're physiologically not quite ready. Or is there a complication? Are we needing to induce because mom's not okay, baby's not okay, there's some other problem? Pitocin is really interesting. It is a synthetic form of oxytocin, which is our bonding hormone. It helps with attachment, it helps with bonding, it's helps with breastfeeding and sleep and all sorts of things. And Pitocin is not the same thing. It is a synthetic form that causes uterine contractions. It does not cross the blood-brain barrier, so moms don't get the same like euphoric benefits that you get from natural oxytocin. We don't, there's obviously like debate and speculation that that can affect things like attachment and maternal anxiety and depression and some other things like that. We don't have really good data or research that shows like, yes, this is a problem, or it's just one of those things that's kind of in the spectrum. What we do know is that if mom takes certain narcotic medications that are not typically given in labor, if she takes them too close to delivery, that can affect babies like respirations and how well those reflexes work, that type of thing. We do know that babies that are separated from mom after birth show certain like some of their reflexes are diminished. So babies, when they aren't born with any medications in their system and they're not separated from mom, will typically do something that we call the breast crawl, where you sit them on mom's belly. And if you leave them alone and give them enough time, they will crawl up and latch themselves on to nurse. You do not see that in babies that have been exposed to any narcotic medications or that have been separated from mom, which might sound like it doesn't really matter because most of the time we don't wait anyway. Moms just are going to latch their babies on and it doesn't really matter. But what it tells me when I'm looking at that is like, oh, well, when we separated from mom, now their reflexes aren't quite working the same way. So that doesn't mean that it's necessarily going to be a problem forever, but to me, it's telling me, oh, there's something about this separation that affects baby's nervous system and the way that their brains are working. And we don't have enough information to know, is that a problem long term or not? We're just looking at kind of all of these, how all of these pieces are connected.
Birth trauma, such as cord around the neck, shoulder dystocia, long or stalled labor, emergency interventions can lock reflexes in place. How does the baby's nervous system remember these events even though they have no conscious memory of them?
Well, that's the thing about nervous systems is they're not conscious. All of these things are happening at this subconscious automatic level. And thank goodness, because we don't need to be in charge of any of this. But what we're talking about when we're looking at like things like reflexes and brainstem function is all of these early automatic pieces. These are the pieces that are built in. Like I mentioned before, these are the lizard parts of our brain. They're there for survival. They are not something that we are aware of. They're not something that we can really control. They are outside of the kind of spectrum of conscious things. Um, and like I mentioned before, I even hesitate sometimes to say like that it is dysfunctional to hold on to these responses because actually, in many cases, it's adaptive. What we're seeing is a normal, healthy adaptation to an unhealthy, abnormal, unsafe environment. That actually our brains are pretty intelligent, and then that baby is responding in a very adaptive and normal way. It's just that we weren't we shouldn't be developing and growing up in a lot of the environments that we are, and a lot of the things that we experience are not things that we should be experiencing regularly. And again, it's rarely one thing. It's usually, six, seven, eight things that are all compounding, and then it's too much.
The fourth trimester, those first 12 weeks after birth, is critical for reflex integration. What are the most important things happening developmentally during this window, and what derails it?
Sure. So there's a couple of really big things that are happening. The first actually has very little to do with reflex integration, and that's attachment that's happening. So babies are basically learning how to function socially in the world. And so when we talk about things like attachment, what I'm referring to is like attachment theory in the psychological realm, where basically the idea is that our relationship with our early caregivers, so typically mom and dad, shape the way that we relate and connect to people forever. And not just people, but to ourselves and to emotions and to our whole environment. It is one of the most like robust topics in the psychology world. And thankfully, it's starting to get a lot of traction. We're starting to see like, oh, these early relationships really play a huge role. And when we don't develop good attachments, it's very similar to having a retained Moro reflex. We're basically functioning and operating out of a lack of safety. And so what should happen for babies is they develop what we call a secure attachment, where their caregivers are pretty responsive and they're warm and their needs are met and they learn, when I'm uncomfortable, that somebody comes to help and I survive it and we move on. But there's a lot of things that can disrupt healthy attachment, a lot of cultural things with the way that we practice parenthood, a lot of things like maternal mental health issues and struggles, which can be compounded by things like birth trauma and complications. And there's a lot of things that go into shaping how babies relate and connect to other people. And that can either be really protective for mental health later, or it can be one of the things that really detracts from our ability to develop stable mental health later on. So attachment is one of the big things that's happening. And then lots and lots and lots of brain development. Babies are going from basically being utterly helpless to being totally mobile and independent at a year old. And I don't mean, when I mean independent, I mean able to move and do things on their own. Obviously, they're still very small at that stage. There's a lot of brain development that happens beyond that. But there's just this explosion of things that's happening. So all of these reflexes are in charge when they're first born. And then very quickly, as their bodies start to develop and their brains start to develop, they start to get control over things. They can move their arms, they can move their eyes, they can start to make decisions and interact with the world. And as those pieces develop and strengthen, these reflexes should start to back off and disappear. And then they're not really in charge anymore. We have other parts of the brain that are in charge. But like there's a lot of things that can disrupt that process. That doesn't always go smoothly. And then you can see kids that other parts of their brain don't develop well. These reflexes hold on. They have these kind of immature patterns of functioning and interacting with the environment. And that cascades into a lot of other things, like they don't process sensory information well, or their eyes don't develop well, or they don't have good coordination, which then affects attention and executive functioning and, the whole thing down the line.
No, man. Separation from mom, whether due to NICU stays, postpartum complications, or even cultural practices around hospital nursery time, can have lasting impacts. Can you explain why physical and emotional connection in those early days matter so much for reflex integration?
Yeah, well, it's both reflex integration, which I kind of touched on this a little bit when I was talking about that breast crawl thing. As we know, like, oh, when they're separated from mom, it definitely affects at least some of their reflexes and the way that they work. Babies aren't supposed to be separated from moms. It's not good for moms. It's not good for babies. We are not like biologically designed to be separated from our babies. They're really supposed to be close. So reflexes are one of the big things. Our stress response is huge. Babies definitely show a lot more signs of distress when they're separated from mom. And then attachment is the other big thing that's happening, is one of the most important things that babies are learning when they're first born is that I am safe, the world is safe, people are generally pretty reliable. That is the foundational lesson that all other learning and development is built on. And if that piece isn't there, we're going to have lots of other holes and gaps and problems later on. And so, one of the things that it can affect when moms are separated from their babies is that babies don't get that quick responsiveness. And also, there's just a lot of things that are typically happening to babies when they're separated. Usually, now, when babies are separated, it's because they need to be in the NICU because they're not okay. Um, and unfortunately, in the US, we don't have good standards of care for taking care of babies in that. There are other countries that, and certain places where they're really like developing what we would call true kangaroo care, where basically everything is done on mom. So mom's there, they do everything that they can possibly do while skin to skin with mom, or dad or somebody else. And so all of the other interventions and things that are happening, it's at least they're getting that connection where they're close to mom. They haven't gone from their entire world, everything that they've known is being next to mom all of the time to all of a sudden they're totally separate from that. That's helpful for moms. That's helpful for babies. It's helpful for attachment. It's helpful for milk supply and breastfeeding. And then the other thing to consider for these babies is that if they need a lot of help, a lot of times the things that they need that are helpful are also a bit traumatic, that they are intubated or that they are given a lot of medications or that they are like under a lot of lights or other things. Like it's just they need that. And I'm really, really, really glad that we have that as an option and that these babies can survive when 100 years ago they wouldn't have. But it's not an easy journey for them. It's tough. I work with a lot of kids that were once NICU babies, and it's a hard road for them.
Yeah, my son was in the NICU for 12 days, so all of this is very close to my experience for
Yeah.
sure.
Yeah.
Feeding challenges, tongue ties, reflex, colic, and breastfeeding struggles often go hand in hand with retained reflexes. Is it a chicken or egg situation? And what should parents who are in the thick of those struggles do?
Yeah, so it's never black and white. So, no, so one of the things that we do see a correlation with retained reflexes is a lot of things like midline defects, where kids are more likely to have tongue ties. They're more likely to have breathing and airway issues. They're more likely to have sleep issues. They're more likely to have had breastfeeding issues. And all of these things, like I said, they're all kind of compounding. So if you look at normal development, things like having like breastfeeding sets us up not just physically to have good nutrition, but it shapes the way that our airways develop. It shapes the way that our mouths develop. It shapes the way that our ears develop and the way that we drain fluid, the way that our vestibular system functions. Like all of these pieces are connected. And so when you have a baby that doesn't breastfeed well, they don't get all of those benefits. They're more likely to have breathing issues, airway issues, yada, all of that thing. And so what that looks like in older kids is they come and they've got all these reflex issues and they've got tongue ties and they're mouth breathers and they don't sleep right. And we have all of these factors. And I don't have any like single black or white process by which we tackle these things. It's very individualized. So usually, I lean towards doing nervous system stuff first, and then building in airway stuff as kids are able to tolerate that. Sometimes, like the apparatuses and the therapies and stuff that you need to like affect the airway can be really overstimulating for some kids and can really stress them out. Other kids do fine with it. If the opposite is true and they have a lot more of like airway symptoms or a lot more gut symptoms or whatever it is, then we might start with that first and see. So, in general, I like to try to tackle a lot of those things, but we want to be really careful that we're not doing too much, especially when you have a nervous system that's really sensitive. Adding in tons and tons of therapies can be counterproductive and can actually set us back. So sometimes less is more when it comes to these types of things, and it's always individualized. And I'm always open with and kind of honest with families about if we want to try it, we can try it and see how they're doing. These are kind of the areas that I'm seeing that are not working right, that we might want some additional support in. But I'm not a magic 8 ball. I don't always know what the best place is to start. Sometimes we try something and then we have to try something else. Sometimes we nail it and it's great. But
Postpartum maternal mental health, depression, anxiety, PTSD from birth affects the baby too. How does a struggling mother's nervous system shape her babies? And what does this mean for moms who are doing their best in a hard season?
Yeah, I mean, we have a lot of research that shows that maternal mental health dramatically affects babies and long term too. So, ki older kids are significantly more likely to be diagnosed with things like anxiety or ADHD if they have a parent with one of those things. And some of that is genetic. Some of that is that we pass on more than our genes. We pass on our nervous system, we pass on our patterns, we pass on our diet, we pass on our environment. And so there's a lot of factors that go into, how like why we see this connection between like kids' mental health and their parents' mental health. But certainly, I have worked with a lot of moms who had a lot of postpartum and anxiety issues when their babies were little, and it affects how responsive you can be. It affects your outlook on the world, and you're teaching your baby how to function in that world, whether consciously or unconsciously. And that's not to say that in any sort of guilting way. I'm a mom that had a lot of postpartum struggles myself, so I really get it. And sometimes you just are doing the best you can, and that's it. Um, but yes, it certainly does. And so if you can identify those things early, if you can get support, and when I say support, I don't mean get a Starbucks drink and take a bath. I mean, like, let's
Right.
get some actual genuine support with, where we have like financial support and people making you good, nutritious meals and like actually meeting the needs that parents have, which is sometimes really, really hard in this society and culture. Sometimes we're just literally doing the best we can and we just have to get through it. So,
Mm.
but
Yeah.
your baby's not ruined. They can adapt.
We hear a lot about container baby syndrome, too much time in car seats, swings, bouncers, and other gear that restricts movement. What's happening to a baby's development when they spend most of their day in containers, and how much movement do babies really need?
Yeah, I mean, we kind of touched on this. Basically, movement is how your brain develops. So, all babies need a lot. A big part of early brain development is actually early brain and body development. It's that babies are learning how to do all of these early things. They're learning how to sit, they're learning how to crawl, they're learning how to walk, they're learning how to engage with the environment. And that happens through movement. And it doesn't just happen through their own movement, like it can happen when you put them on the floor, but they also get a lot of really good movement when you're wearing them. So if you're wearing a baby, then they are interacting with the environment in similar ways that you are. So that helps to develop a lot of things. That helps to give them a lot of movement. And then they do need time on the floor where they're not just getting passive movement, but they're actually actively engaging with the world. Putting them in things like containers, bouncers, seats, all of that can be really helpful for short periods of time if you need to like make dinner. It's like, I get it, I've done it. But it shouldn't be where they spend most of their time. They need a lot more time to move, to work through these reflexes, to develop their visual skills, to develop all of these coordination pieces. One thing that I think people don't really quite understand is that the way that our body moves is kind of a direct reflection of the way that our brain communicates. So if the left and right sides of our body are not communicating well, the left and right sides of our brain are also not typically communicating well. We have this really direct connection between that. So if babies aren't doing things like crawling, like learning to cross their midline, like learning to move and play properly, it directly affects the way that their brain develops, the way that it communicates. And when we have poor communication between the left and right hemispheres, you see delays in things like memory and impulse control and like these advanced cognitive functions. They tend to be kind of laggy. They're slower. They're less
Mhm.
automatic.
Yeah, like tummy time, floor time, free movement, and crawling are all constantly under prioritized in modern parenting. Um, what is the cost when a baby skips or shortens any of these stages, especially crawling?
Yeah, crawling is a big one. I am just like a little bit shocked. I shouldn't say shocked. I'm not that actually surprised by it, unfortunately. But, I'm sure the CDC pulled their recommendations for crawling, which is
Yeah.
just utter, like, ugh. I'm gonna start swearing on this podcast. Sorry.
It's crazy. Like I don't know what they would point to that would make
It's
that be a sign.
insane.
Yeah, yeah.
It's because it's becoming common. And so we're normalizing dysfunction just because it's happening a lot. It's not okay. But crawling is really important for a lot of different things. One of the things that's happening is we are building connections between the left and right sides of our body and our brain, like I just mentioned. The other thing is that crawling is the first time that babies are actively engaging with their environment in ways that they choose. So, like when you're wearing them and you're moving around, they're getting a lot of passive movement.
Yep.
They're, seeing different things. Their eyes are getting a lot of stimulation. But when they're crawling, they're doing it all. And so it's huge for developing a lot of visual skills. They're also learning to look like at their hands and then look up in the room and switch between looking at things that are close and looking at things that are further away. And that skill, that visual skill of being able to converge your eyes and look at something close and then move further away. So that switch is called accommodation. Those are visual skills that you need later for reading and writing and things like that. Those pieces are really being developed heavily during this crawling stage. And we know that there is a significant connection between crawling and literacy. So when you look at cultures where babies don't crawl, they're basically worn until they walk. Typically, when you look at like tribal communities where they don't spend a lot of time on the ground, they're mostly just worn. Those are societies that or cultures that typically don't have a significant written language. And what happens is babies' eyes develop based on how they're using. So they tend to have poorer near vision and really good distance vision, which is more adaptive when you're living in that type of environment. So we know that in to some extent crawling is helping to set babies up for the skills that they need for literacy. We also know that there is a connection that babies that skip crawling or don't spend very much time crawling are significantly more likely to have reading and writing issues later on. And again, it's not a causal effect. Some babies skip crawling and they're great readers. It's not the only thing that develops our eyes, but it is one of the big things that goes into it. So crawling is a huge one. And that's all of our little motor stages affect that in some way. Crawling is just kind of one of the more dramatic ones that's easy to look at.
Yeah, and it also affects the ability for coordinate the two halves of your body, both the left
Mhm.
and the right side, and the upper and lower body.
Mhm.
So that can affect like riding a bike, learning to swim, anything that involves that kind of
Yes.
upper and lower, left and right side of the bodies.
Yes, for sure.
Mhm. If a parent is listening and realizing their pregnancy, birth, or early postpartum had several risk factors we discussed today, what is the very first thing you want them to do? And what is the most important mind shift that they need to have?
Well, first of all, I would say, like, okay, if you had some of these risk factors and you're like, oh no, that sounds like my kid, but your kid's fine, then don't worry about it. They're okay. They made it through. If you have a kiddo that's struggling, they have a lot of big emotions, they're not connecting socially, they're struggling with school, they're having some other problem, then definitely look at these early factors. And if they have a lot of these risk factors, then more than likely, at least some of those struggles started during these early stages. And so you want to find support that looks at those stages rather than focusing on symptoms. So, like if your child's struggling with reading, you can do all the reading tutoring in the world, and you can probably get a little bit better and a little bit faster. But if their eyes aren't working right and they can't coordinate their left and right side, then reading is never going to be as automatic and effortless and easy as it could be if those tools were in place. So, same thing with emotion development, same thing with things like anxiety and social connections. If kids don't have these early tools, then we can help them cope with the symptoms a lot, but you're never going to get the same amount of success as you do if they actually have the tools that they need in order to develop these things properly. So, if you're concerned about your child, then reach out to somebody like me, or then reach out to me or somebody like me who does this type of development work. I strongly recommend INPP, that's the Institute of Neurophysiological Psychology. That's where I did my postgraduate work. There's several of us in the US that do this. It's growing, it's small. But I can certainly try to get you connected with people there. And then I do work with families remotely if there isn't somebody that's local to them. So,
Amazing. How can parents get a hold of you?
Probably the best place would be to go to my website, earlyrootsTherapy.com. I have links there to my socials, so like Facebook, Instagram. I have links to my blog and podcast, and there's lots and lots of resources for anybody that cares to dive in and learn more. That's probably the best place. But you can also find me on Instagram and Facebook at Early Roots.
Awesome. Emily, what I hope listeners walk away with today is that it isn't about blame or guilt. It's about awareness. So much of what affects our baby's nervous system is invisible until you know what to look for. And even then, most families are doing the very best they can with the circumstances they're handed. The beautiful part is that the body's incredibly resilient. And when you understand what your child's nervous system has been through, you can start giving it what it needs to heal and integrate at any age. For everyone listening, we have full articles in each of the reflexes Emily mentioned today over at fledglingsflight.com, also on her website, including infographics that walk through risk factors and what to watch for. Thank you again for your time. I always love our conversations.
Thank you so much. It's so fun to chat with you.
Thanks for tuning into A Parent's Guide to Child Development, where we decode milestones, demystify meltdowns, and occasionally question whether goldfish crackers count as a food group. Spoiler, they do. Make sure to follow us on Spotify and subscribe to our YouTube channel so you never miss an expert tip, breakthrough strategy, or aha moment that can make a big difference in your child's development. It's cheaper than therapy and less messy than glitter slime. We'll be back soon with more expert advice, real talk, and zero judgment. Until then, keep calm and try not to step on any Legos.